Iodine deficiency. In iodine deficiency, no iodine, no formation of T3 and T4 hormones. And last one is the damage to the pituitary gland. So there is the damage, no secretion of the TSH hormones, no stimulation of the thyroid gland, no formation of T3 and T4. Let's move to the hyperthyroidism causes. So hyperthyroidism causes are the Graves' disease due to the thyroid stimulating immunoglobulins, thyroiditis due to viral infections, injury and other causes, and last one is overactive thyroid nodules or toxic adenomas. Up to this much we have covered the hypo and hyperthyroidism and its causes. Now let's move to the symptoms of hyperthyroidism. So for the symptoms, let's assume of people in hyper state. If the people is in hyper state, requires the more energy, they will lose weight, heartbeat will be high, sometimes it would not be maintained, and so there will be irregular heartbeat, pounding activities, increased hungers, burning of fat, thinning of skin, breakdown of protein, so muscle weakness, increased thermal sensitivity, sweating. After this much think their work is not too profitable, then they will be nervous, anxiety, tremor and irritability. At last heat radiate through head, so fine brittle hair. Okay. Similarly for hypothyroidism, think lethargic people, no energy required, so weight gain, sitting alone, so will be depressed and nostalgic sometimes, so memory problem, no work, no, so body is cool and increase the sensitivity to cold. There is the common symptoms, that is irregularities of menstruations, heavy menstruations, tiredness, and muscle weakness in both hypo and hyperthyroidism. At the end, I will try my best to make you able to understand the algorithm for testing the hyper and hypothyroidism, which is along with the other condition. So let's get in. First of all, we will perform the TSS test. So there might be the chances of normal TSS, high and low. If there is normal TSH, no worry, it's euthyroidism. But when there is the low, then we will go for the EFT4 test. And while performing the test, there might be the two conditions: EFT4 normal and EFT4 high. So when there is EFT4 normal, we will go further to perform the EFT3 test. There will be the two chances again, either normal or high. So if TSS is low, T3 normal and T4 normal, then it is the subclinical hyperthyroidism. But TSH is low, EFT4 is normal and EFT3 is high, then the condition is known as T3 thyrotoxicosis. Again, when TSH is low, EFT4 high and EFT3 high, then it is known as the hypothyroidism. Sorry, hyperthyroidism. Now we are at the TSH high. So when there is the TSH high, we will go for the EFT4 test again. There might be the three cases, either EFT4 normal or decreased or increased. So when there is the EFT4 normal, we will proceed further to test the EFT3 test, and we will conclude that TSH is high, T4 normal and T3 normal, then the condition is subclinical hypothyroidism. But when there is the TSH is high, T4 decreased and T3 decreased, then the condition is hypothyroidism. Similarly, when the TSH is high and T4 high but T3 normal, then the condition is primary hypothyroidism. So hope you all understood these algorithms, and now I can say that we have completed the thyroid topic. Have a great time. Bye bye.